This is Chamber Chat on Chamber Channel 3 and 117.2, brought to you by Mansmith's Pharmacy, where your care is their only concern.
This is Chamber Chat, brought to you by Mansmith's Pharmacy, and I'm Deb Height. Today we're visiting with Jean Eichmeyer. Jean is a physician's assistant at Family Practice Clinic, and we're glad to have you here today.
Thank you.
I hear there's some awfully exciting things going on at Family Practice Clinic right now. Can you tell us about them?
Oh, I'd be really happy to. That's exactly why I'm here. And I think it sounds kind of funny when you think of exciting things happening at a clinic because, you know, we all have our own ideas of what happens at a clinic. But I'm here particularly today to talk about Sculpt, which is the name for our new clinic for medically managed weight loss, and then for therapeutic skin care, and then for skin rejuvenation.
Awesome. Sounds interesting. I'm particularly in tune to that medically managed weight loss.
Yes! That's a hot topic these days.
It sure is. So tell us about that.
You get into January, and this is how we do it. This is an exciting concept. And I think what's also extremely exciting for us is that we have progressive thinking people out at Palo Alto County Health System who have seen these types of programs crop up all over the country and all over Iowa, and started thinking, you know, how much of this, what can we do? What can we provide here for the citizens of this community? And the way of life is a very protein-based diet. When we say medically managed, it is. You've got Dr. Patricia Banwert, who has had extensive education with this form of weight loss. So she's there to help people every step of the way. And what's exciting about it is it works.
It works. You said you've seen some cases.
It works. For me as a provider, I have referred several of my patients. And I'm going to back up a minute just to say what type of person wants to lose weight this way.
Okay.
A very typical scenario for me in my office setting is the person who comes in and the first thing they say to me is, I don't want you to look at that weight. I haven't lost any weight since the last time I saw you. This is all very typical, and it makes us laugh, but at the same time, it's frustrating. It's very frustrating for people who, for maybe the lion's share of their adult life, have really struggled to keep their weight managed. And you can't be awake these days without hearing what a problem that is in the country. And all looks aside, obesity is a threat. It's a threat to our health because of all the systems it affects. Your cardiovascular system, what I tell folks is, your heart just gets tired of lugging all that around. It just makes it wear out a little earlier. Mm-hmm. Of course, it's the #1 risk factor for the development of diabetes, and diabetes, represents a whole different ballgame with the things that can rob from you. Obesity contributes to high blood pressure. It contributes to bad hips, bad knees.
Right.
So I just probably overstated the obvious, but obesity is a huge problem. But folks will come in and they'll say, I've tried every diet known. I've done this, I've done that, I lose weight, it comes back on. But it's truly it's a very real thing. It's a very real frustration for these folks. And so they go in and they talk with Dr. Banwert. And they say, help me out. She's there with her medical knowledge. So if you are a person who comes in with considerable medications due to this health issue or that health issue, she's a physician. She's there to walk you through it every step of the way, keep track of that blood pressure, keep track of blood sugars and things as we, more than likely they will change with weight loss.
Sure. Sometimes people even lose enough that they get off those pills, right?
We've had people with great success with managing those health issues. And I think that's what's fun. First of all, they know it's doable. They've got this coach, which is hugely important. We all need that kind of support, whether it's for weight loss, for smoking cessation, for alcohol use. You've got to have that support. And what's fun for me is I'll be out there in the mornings, and they'll be coming in to weigh or to meet with Dr. Banwert. And for the first time, you watch them step up on that scale, and they've got a big smile on their face. It is really fun. And as they come back, women are complaining that, things are getting too loose and they're going to have to find someone to take it in, but it's really exciting. And then when I see them back as a provider, too, to sometimes be able to really say to them, you don't need this anymore. That is such a motivating factor. It's just so motivating.
You just mentioned women. Is this a program for men also?
Oh yes, and I should not be inclusive. You are absolutely right. We have many men who have been very successful with this program.
Awesome. Sounds good.
And there was one gentleman in particular, one of my patients, and I have enjoyed caring for this man for many years. And he finally came in one day and said, "That's it. I can't tie my shoes. I can hardly tie my shoes." Well, of course, it was hilarious. And in some respects, I've been waiting a long time for him to decide that this is something that he's ready for. And this program just fit perfectly for him.
Great.
Fit perfectly.
Great. Well, that sounds very interesting. I would be interested in learning more about that myself. So Sculpt is a managed weight loss program. And I understand it has a skincare component.
Yes. We are going to be introducing, and what I said earlier was therapeutic skincare, and also rejuvenating skincare, because there is a difference there. Therapeutic. We live in a harsh climate, and also most of us have not done a very good job in our lifetimes of taking care of the largest organ of our body, and that would be our skin. Skin afflictions, rosacea, which is the redness, the broken blood vessels, and sometimes the acne component. Rosacea can be very difficult to manage and very, it's not disfiguring, but because our face, it is right there, it's the first thing, it's that, it's that presence that immediately is in front of people, it's important. And when you've got discolorations, you've got hyperpigmented areas from acne scars, or melasma. That's the dark brown discoloration that women do get much more than men because it's a product of our hormones.
Okay.
They used to call it the mask of pregnancy. But melasma, rosacea, acne, I'm so excited to have a line of skincare products that does such a great job on acne.
Wonderful.
And eczema, psoriasis, we just have some wonderful products that are available, and I'll talk about those in just a minute. And then the rejuvenating is, well, I'm kind of like that demographic, we've got the lines going, drier hair, much more wrinkles than I used to have. And I think, as Deb and I were talking earlier, I think there is something to be said for a healthy amount of vanity.
That's right.
We all want to
feel good.
Yes, it represents who you are. Healthy skin looks good. You can put on all the makeup that you want, but if underneath that makeup, your skin's not in good shape. So that is the promise of this skincare line, is to give you healthy looking skin.
Wonderful. So this is product driven?
Yes. The product line is PCA Skincare. That's Physician Choice Alliance. And I'm excited. I'm excited for this size of community to have this line here. It is the industry leader. It is the industry leader because it truly works at the cellular level. You can get the Oil of Olays and the Revlons and use all those types of products, but they aren't, there's not good science behind those products. There's cosmetic science, but not the science of medicine, and how do you interact with the skin and with the dermis and all the things that cause the discolorations. How do you interact with those? And that's why PCA professionals are healthcare providers. Okay. And so that's exciting to me.
So you said Dr. Banwert is kind of the gal to see for the weight loss, and you are the one to see for Sculpt, am I right?
And Dr. Banwert and I have both been trained on PCA.
You both have? Okay.
Yes. And so it offers PCA skincare line, or what we will offer to people, is an evaluation of their skin. You know, not only people will come in and say, I don't like this, but oftentimes too, people will come in and say, I'm worried about this, or I'd like to change this. So that's, you know, certainly that's our part of it. And PCA offers the line of everyday products that we should use for our skin. Cleaning it, moisturizing it, protecting it from sun. I wanted to look right at the camera when I said that, because it is such an important thing. And then we are also going to be offering peels, chemical peels. Now people get a little nervous because they have a preconceived notion that after a chemical peel they won't be able to be seen out in public for 2 weeks. No, and that's another thing about having such a great line. PCA peels are not aggressive, again, because they know the science of skin biology, and there's no downtime with these peels. I've had them myself, and the first couple of days your skin looks amazing. It's soft, it's dewy, it looks so youthful. About day 3, you will start to peel. It kind of looks like you've had perhaps a very minor sunburn. Just a little flaking, you know, here. But nothing that you can't take one of the provided moisturizers and smooth out, but you can carry on with your day.
So what's the purpose of having a peel?
The peel is that extra step. If you are looking for, especially for acne management and the pigment disorders, it's that extra step in going deeper into the dermis to lift out the bacteria, to lift out the discolorations. So that's how they work therapeutically. For those of us who are in the wrinkle market, those peels work to stimulate collagen, which is what makes your face full and helps again give that appearance. And when you have adequate collagen levels, and when you've lifted, pigment is damage. Sun tanning is damage. If your skin's brown and we're Norskis, that's generally not considered a good idea. And so that's, again, when you are promoting the health of the skin, you're going to have much better looking skin.
Wonderful. Well, very interesting. You know, when you first talk about it, you wonder what process is. You know, we talked about it's not Botox, it's not those false kind of things. This is just good skincare.
And, Botox is, people kind of talk of that like it's, something that creates a very unnatural look. But the FDA approves Botox for this, smoothing out those crow's feet. And it is something in addition. If this is something that people would like, I can offer that for them too.
You can? Okay.
Yes, absolutely.
I wondered if that was part of the program. Okay, I'm excited because we're going to have a chamber coffee here on Friday the 22nd to promote what you're doing, you and Dr. Banwart. And but there's even more exciting things going on that following Sunday the 24th. So tell us about that.
On Sunday afternoon, the 24th of February from 2 to 4:30, we'll have our open house event, and that will be fun. We'll be able to demonstrate. We're going to do a couple peels.
Cool.
Show people out there that it's nothing to be afraid of, and plus when you've got someone that you're actually working on, when they sit up and go, oh, this is so nice, then that really helps people feel good about it. But more importantly, too, we can show them the product line, have an ability to explain to them how great these products are. People always want to know about costs. I think, why, deny that.
That's right.
These skincare product lines, I can tell you, are not appreciably more expensive than anything you can buy over the counter. And I can say that with a straight face. There are some of the serums, some of the more advanced product line that we may need to use for certain conditions, but they last forever. They're wonderful. But people need to see this, otherwise, they're not going to believe me.
Okay, somebody's going to ask, so does my health insurance pay for something like this?
No. And that's a very fair question. Health insurance will cover, now, that being said, I have people come into my office all the time to speak to me about their skin conditions. So yes, in an office setting, absolutely. Coming in for this type of skincare, no.
Okay.
And thank you for asking that, because that's really true. Because there are shades of what's going on with a person's skin. And at the open house, we'll have an ability to do that. We're going to have a drawing. We have a beautiful package of skincare from PCA, a $250 value that we'll be able to have for our door prize, which I think is really fun. The Way of Life will have a product display and people available to answer questions. We'll be able to, and you'll be able to sample that very good tasting food. So I think it's going to be a fun afternoon.
So where do we find this open house?
That'll be out of the clinic, in the lobby of the Family Practice Clinic, from 2 to 4:30.
2 to 4:30. Okay.
Very,
awesome.
In and out, come right away, watch what's going on. But I'm looking forward to it. I think it'll be a fun and enlightening way to spend a couple hours on a Sunday afternoon in February.
Well, it's so exciting, too, that this is available here in Emmitsburg.
Yes.
That people don't have to drive out of town. And then, of
Yes.
course, as Chamber's concerned, we always like it when we can feature things here in town so that people aren't tempted to shop out of town while they're, and eat out of town and do all those things.
And we want people here in our, greater community to know that we are progressive.
That's right.
That we are as interested in providing these types of services as anybody. I think that's, just important. You always have to think in terms of moving forward. Otherwise, we will be left behind.
That's right.
And this is just such, and for me, again, it's such a great opportunity to meld a couple of healthcare concepts. I think that's just, very exciting.
It is very exciting. We're so glad you're here today.
Thanks, Deb.
Do you have anything you want to share at the end here before we close?
Oh, gosh. Oh, yes. Tell your chamber people to be, very prepared to eat very healthy food at the chamber meeting.
And I've heard what they're looking to serve. But don't be afraid, folks. It'll be good. It'll be good. It'll be very good. Anyway, we want to thank you for joining us today, and we want to thank you, Jean, for all the exciting things happening at Family Practice Clinic. And this has been Chamber Chat, sponsored by Mansmith's Pharmacy, where your care is their only concern. Thank you.
This has been Chamber Chat on Chamber Channel 3 and 117.2, brought to you by Mansmith's Pharmacy.